Welcome to the Asking for a Friend podcast, where we bring the experts from Donaldson around the table to explore everything health and lifestyle to skincare and appearance. Today, we're getting your top skincare questions answered, like the game-changing treatment for your skin tightening and everything you need to know about off-label filler and Botox. Have you heard about the Daxxify glow? Well, you're going to hear about it today. And what really works for dark circles under your eyes. And did I mention how injections and lasers actually help your orgasms? Yep, we're going there. Joining me today are my friends and coworkers, Dr. Marguerite Weston, Stacy Isler, and Adrienne Yannick. I am so pumped to have them on this episode. Dr. Weston is our double board certified functional medicine physician. Stacy is our surgical physician assistant and patient care director. Adrienne is our nurse practitioner, and both Adrienne and Stacy are masters at injectables, lasers, and cool sculpting to help patients look and feel their best. Let's dive in. All right, guys, so thanks for coming. I wish I could say this was my beautiful home, but it's not, but it's amazing, and thank you for hosting. So we're here with Dr. Weston as always, and Stacy and Adrienne. They're injectors at our office, and they stick needles in my face on the regular. Yep. So I want everyone to get to know you guys because you're amazing. So let's kind of just start with your background. Like, we can start with you, Stace, but...
Well, can we start with the cheers?
Oh, yeah, let's start with the cheers.
Jeez.
Sorry.
Cheers,
we talked
ladies.
about that, and then we didn't do it. So let's talk about your background, like where you came from, how you got to Donaldson.
Yeah, so I actually started at the James, so I did reconstructive microsurgery.
Nice.
Sounds fancy.
Cool. Really?
Yeah. And I loved it. I love being in the OR. I love using my hands. I learned so many good technical skills there and so much about like public medicine. It was like raw, dirty, great training. So I did that, and then I will, pat myself on the back. I did both my pregnancies, one with twins, full term, and then with my son, we did a 14-hour surgery the night before I had him.
Yes. Cheers to that.
On my feet.
I love that.
So cheers that. That's impressive.
Probably why you...
So that was all amazing. And then the schedule, didn't work with my family. And I'm like, this is why I wanted to be a PA and not surgeon. And so I ended up getting into aesthetics as kind of like the backup. I was interested in it, I thought it would be a good transition. So then I got into aesthetics and haven't looked back.
I love it. And you have how many kids?
3.
What are their ages?
Twins that are 10 and going to be a 13-year-old going on 15, 16, 18.
Dark side. Fun.
The teenage.
So you're busy.
I'm
a lot
busy.
of balancing.
I am wildly busy, but when I have downtime, I do not know what to do with myself, so I don't know what I would do if I wasn't busy.
She told me earlier this was her first night without sports since
Christmas.
Oh my gosh, and you're doing this with us, so thank you for that.
I
am. And it's my husband's birthday.
And so
cheers, honey.
Happy birthday, Brent. Thank him for letting us borrow you, but your turn, girl. Let's go.
So my background, I have done every facet of nursing that you could possibly do. I started as an LPN when I was about 20 years old, hot minute ago. I worked as an LPN for a long time. I did a lot of office-based work, so oral surgery, post-surgical rehab. I did some long-term care and Alzheimer's care, loved all of that. Decided to go back for my RN at, a later age. Did that, finished my BSN, and I'm actually 1 semester away from finishing my NP. Fingers crossed. So
Cheers to that, too.
Cheers to that.
Cheers to that, because the amount of balancing. Do you want to talk about balance?
I know. I'm about to ask how many kids are in her life.
Because that's bananas.
So, finishing grad school, I've actually loved every bit of it. It's been a blast, and it's been great to be able to bring it back to the practice. And just to bring a different thought process to how I'm treating people. So that's been wonderful. So that's kind of my nursing background. Family life, we are very busy. We have 5 at home. They are 19, 17, 16, 15, 12, almost 13. So this is not a night without sports. I will be heading directly to a lacrosse game after this, so go Braves.
Love it.
It's busy, but I really love the work that I do, and I think it's really important for people who want to feel really good about themselves in their day-to-day lives.
I love that. Speaking of that, like, you've done this a long time between the two of you. What, I don't know, like asking for a friend, they always ask me when I talk to anybody, like, you know, what services do we offer? But let's just start there. Like, we offer all the normal Botox, filler, lasers, everything like that. What are your like absolute favorites of the services we offer?
I mean, I love the Morpheus 8
Why do you love it?
because it works.
How does it work?
It works. It helps with skin laxity, and there's like no other device on the market like it. We've tried. There's been a lot of imitators. There's not been one that's delivered results like we've seen with the Morpheus, and that goes for any skin type. It goes like who's a candidate for it? Everybody, literally everybody.
Nice.
We can use it on post-op scars. We can use it for facial tightening. We can use it on our facelift patients after they have these wonderful facelift results. It's for everybody, and I love it.
I love it. Is it only for the face?
No, anywhere on the body, as you know.
Nice. I had to ask.
I had Morpheus about a week ago. My neck is still a little lumpy bumpy. I just did my neck this time. Hurts like hell. All right, it hurts like hell.
But I feel like if it doesn't hurt, the more it hurts, I feel like the more it works. That's just
to be very
I'm with
fair,
you.
Yeah.
No pain, no gain.
I agree.
But what do you do to help the pain?
So we have a lot
I ordered
of things.
2 margaritas from Condado.
Man, hey.
That's true though. You're not lying.
Anything that
not
you
lying.
do that's skin tightening, if it's not a little bit uncomfortable, the unfortunate thing is you're probably not going to get result.
Yeah, agree.
So, there are things that you can do. You can block the whole face. I mean, there are risks involved with extra anesthesia, but we topically numb. We do have laughing gas, which is effective
That's the
99% of the time.
Yeah.
We are able to prescribe extra medications. It's not, like I said, I'm a big baby. It hurts like hell. I'm still going to do it over and over because it works.
How many times do you have to do Morpheus? Like, what's the frequency? Like, if you were going to say, Marguerite, your neck looks like you need to do it and do it, like, really do it to make a difference, how many times do I have to do it?
We start you with a series of 3. Okay. And I say start you, typically a series of 3 is corrective for face and neck.
And I will tell you, at our office, when people sell these machines or products or Botox or fillers or whatever, and they're going to tell you, you need more.
Yeah, right.
Like more is more. We always try that out. Okay. There's not a treatment in our office that we haven't done on ourselves or each other, because I think that's the only fair way to
Oh, absolutely.
Well, that's the way we
it.
test them.
It is true.
Right? If it works. So.
When I first started, I think I came in, I think it was like the first week or 2 I was in, and someone came in and they were a little bit swollen and maybe didn't look the prettiest.
It was probably me.
I think, because when did Morpheus start? Because I feel like it was similar to when
We've had
came.
it for a couple of years.
That's because I started 2 years ago.
We were a little
that was it.
late
and
to the
everyone
game,
was starting
but-
it, and they're like, really hurts. I'm like, are you gonna do it? Here's me. I'm like, are you gonna do it again? And they're like, yeah, I'm gonna do it again. And I'm like, okay, well, it couldn't hurt that bad.
No, and I will say, when we talk about doing a series, people are always like, oh, I need a series, because they just think we're trying to upsell them. That's really not the tactic. And that's where I think being in this game as long as we have, there's a whole play on honesty that comes across, and people read that, I will say no. The most powerful thing you can say to a patient is no. Somebody with huge lips, big cheeks, I want more filler. We're like, no.
Lose our number.
Nope. That's not
it
that's
for
not
you.
gonna be us. So when we say really a series of 3 treatments, we really did a series, all of us, testing it out before we even thought about purchasing the machine. And I can tell you that my results after 3, I was like, I'm in.
Yeah, if I have somebody that just wants one, I'm like, that's great, but why don't you just save up till you can get more? Because honestly, I'm not going to be able to give you the results that you're capable of getting with just a one-off treatment, and it's just not cost effective for you.
And then what's the frequency of those? And then how much downtime, compared to other lasers or whatever?
So I'm going to speak just to the face because that's the most common area that we treat, and say every 4 to 6 weeks.
Okay.
So every 4 to 6 weeks, it can be coupled with other procedures. So we have a great package we call Tighten and Brighten that we couple with BBL and Halo.
That, by the way, is a Donaldson OG thing that we came up with as providers.
Tighten and Brighten?
we were trying to
haven't done
fight
it.
like
It's amazing.
hyperpigmentation. We were trying to fight like all the things. And we were like,
Oh, and stay tuned because we've got some plans about how to
Yeah.
wrap a couple other things in over the next year. But so every 4 to 6 weeks, healing time is, I'm going to say, about a week. And when I say healing time, you're not wearing makeup for a few days. You have skincare to put on afterwards. Like I said, I just had my neck done a week ago, and I mean,
You can't even tell.
I don't care.
is that even a week?
It was last Monday. Last Monday when I thought we weren't filming today. So then I had it done, and then
even
I got
tell.
up from the table
you
like, hey,
can't
by the way,
tell.
we're filming.
Well, and then
like,
I said,
cool.
hey, this is perfect.
Yeah.
Right?
But you really can't tell.
And I'm
can't tell
telling you,
that.
the more jacked up you look, you sell the
That
service.
is
I'm
true.
telling
It is.
you.
That is true.
You come in
They
looking
love
beat
it.
up,
Yes.
swollen,
Yes.
bruised, and they're like, "What'd you
Yes.
do?"
I want that.
I want that, and you're like, "Really?
Yeah, it's true.
Okay."
I always tell patients, you're paying the same amount regardless. So I always say, go big or go
for
home.
it.
Go hard because you might as well get the most bang for your buck. You're paying the same amount regardless of how hard they go or how deep they go or whatever. So
Yeah.
I always tell
Well,
patients that.
and the machine is only the machine, right?
Yeah.
So they have like the manufacturer's recommendation. So people are like, "I got Morpheus somewhere else," and I was like, "But you didn't have Morpheus in our hands."
Yeah.
What, we were in the top 10% of the North America, they
Yeah.
said, or something. Like, that's how much
Yeah.
we do it. And that's, you have to tweak the machine. You have to go beyond safely
yeah.
to get the
Well,
results that you want.
As with everything we do, and this might be a Marguerite Weston comment. It's not the wand, it's the wizard. That's what it is.
Yeah. So it really does matter.
Completely agree.
So I don't take, when you tell me I had one treatment somewhere else, I'm like, that doesn't mean anything.
Well, I literally just made this comment at our meeting this morning. You guys were there. That all these places are just popping up left and right. Like, it's ridiculous. And it literally gives me anxiety because I'm like, where are they finding the providers for this? Because I don't know.
Ask Adrienne about her dissertation.
What?
I will jump up on this counter.
This,
And this is my soapbox. I
Yeah.
have such a hard time. I am very excited for people to explore the aesthetic space and to advance the aesthetic space.
Right.
And I think that's wonderful. And I think more is more. As far as, I don't look at it as competition. I really do think we should all be a community and be helping each other and educating each other. I sincerely do. However, I call this the Wild West of medicine.
1,000,000%.
The Wild West of aesthetics, because there is no regulatory body. There is no educational certification that you have to obtain to be able to inject or to do a laser. Or, to be fair, you do have to have a nursing degree, but there is no formal educational or certification or testing or then further evaluation piece to be able to provide aesthetic services to people, and I have a really big problem with that. And I mean that from every level. I don't just mean that from nurses. I mean that for some of the physicians out there also that are venturing into the aesthetic space. I think that it is very much viewed as a way for people to make money, and that feels to me like it cheapens the service that we give people, because I'm very serious about the way I treat people. I'm very serious about the recommendations I make, and I mean, it's your money. You can do what you want with it. But if it were my money, I'm going to tell you what I'm going to do with it too.
Yeah.
So yeah, I agree. All these places that are popping up, great. More is more. And if we have high quality trained people, wonderful.
Yeah.
But you really have to vet who you're going to see.
1,000,000%.
Because it's not an if, it's a when for a problem or a complication.
1,000,000%. And I say that all the time because, I mean, having not been involved in this industry and I started working here, I would never have thought. I'm like, I would assumed anyone I saw went through all this training and was certified and did all these things. And then I get into this space and I'm like, wow, they took a weekend course and now they're stabbing needles in people's faces, and you can worry about things like skin dying and turning black and falling off. And I mean, that's the reality of it.
For sure.
And it's really scary.
And it doesn't make you a bad injector.
Right. It can happen.
Happened to me.
It can happen.
to Adrienne.
Yeah.
You have to know how to manage it.
Yeah, 1,000,000%.
And I will say, when was it? Probably a couple of years ago, we got a big practice referred us one of their complications. And I was like, it made me kind of like stop and think like, That's great. Like we're a place now that people want to refer
1,000,000%.
complications to.
Yeah.
And I'll put that feather in my hat.
Right.
1,000,000%.
Absolutely.
And the other thing I love, one, you already said it, that you'll say no to people, which is so true. I've seen it time and time again. Like, hey, we're just not the practice
And
for
these
you.
people haven't heard no in a really long time.
Yes.
Some of them haven't, or some of them don't know what they're asking.
Yeah.
You know, I had a patient today who was like, hey, I really want under eye filler. I'm like, that is not the right.
I would love to talk about under eye.
I know, it's so
because I have
hard.
bags of
Everyone
ads.
thinks it's
Us
so
too.
easy.
And
Let's
people
talk
tell
about
me
under eye
like, don't
filler.
put it. So like, what are my options for dark?
Yeah.
Besides sleep.
Wrinkles and like
Reduce
dark
your
and
stress,
bags.
Marguerite. Have you seen a
Stop-
good functional
stop coming.
provider?
I don't know any good functional provider.
No, why don't you stop coming into the office on your days off? Maybe try that.
Okay, why don't we just stick to the question? at
Cheers.
hand? What can you do for under eye filler?
So, okay, I did tell somebody no today, but a lot of it
You
is
tell a lot
not.
of people no.
I do tell a lot of people no.
I feel like it's more times than not, they're not candidates for it, for under eye.
100%.
Yeah.
I tell people all the time, the longer I've been injecting, the less likely I am
Yeah.
to inject tear trough filler.
Well,
and you'll find that
And
like
it's because you've learned as you've gone,
Yeah.
less people are candidates and their long-term benefit is going to be less. So for this person I told today, it wasn't that she was like, not the no of like, girl, you've had your share. Like you don't save
No.
some for the rest of us, you know, like not that. But it's more, they just don't know.
Yeah.
They, you know, and you send me things sometimes. You're like, is this real? I'm like, Carrie,
I
that's not
know.
real. Like
I
don't
send
know.
you Instagram things
All the
time.
time,
I'll be
yeah.
like, hey guys.
And I'm like, Carrie, no, we're not letting that happen. Do not let anybody do that to your face.
Well, I wouldn't.
No. But a lot of people don't know. So, you know, they come in with questions and they're like, hey, could filler fix this, or could Botox fix this, or could whatever fix this? Under eyes are a great topic for that because it's such an intricate area, but it affects everybody. It affects everybody. So like the top three, would you say genetics? Okay. Skin laxity.
Are we talking? Yeah. Why people dislike
Skin
their-
laxity
yes.
and fat pad herniation.
Yeah. Discoloration.
Discoloration, and then a true hollowing. Mm-hmm. Yeah, that's it. Filler is good for a true hollowing, which is about
10 to 20.
Maybe I was going to say 10,
Maybe.
15. Yeah, % of people.
What else can we do for the other ones?
Yeah.
Besides genetics.
I mean,
Well,
what do you recommend for under eyes then?
Go see Dr. Michelle Seifert. And that's another thing I think we have that unique opportunity in our practice that we have surgeons that we can be like, oh, hey, I can't do this. It's easier to say no when you have a solution still for them. You know, it's not like I'm just saying no, like, see you later, best of luck. I'm like, no, but here's the solution. And so 50 to 70% of the time, these people need a lower bluff.
Yeah.
They need surgery.
Yeah.
Like if you have a true fat pad herniation, if you have true skin laxity, we can try the Morpheus.
It does help with
It
under
does
eye
help,
laxity.
but it's not a replacement for surgery. It's just not. And that's being honest with expectations. And
How do you know you're a candidate for surgery? Like, is there...
We'll tell you.
Yeah.
We'll tell you, honestly. And that is, you know, it's difficult during a consultation sometimes. For some people, I think they would find it difficult. I don't think Stacy and I have found it to be difficult, to be very honest with people.
I've never been told I'm not honest.
I think
This would be true.
finesse was left
I've been
out.
told many.
concur.
I've been told many a things.
That's why I come to you and ask you, because I know you guys are no filter and
Yeah.
you're just telling me straight up.
But it really is the art of consultation where you're actually looking at somebody and evaluating them. And if they're a surgical candidate, I'm going to tell them right up front. If there are other non-surgical things that we can do, sure. Like we'll talk about them, the Morpheus, some mid-face filler to help kind of support the region and just give you a little more light source through there. But if you truly just need surgery, save your money, girl. Go get surgery.
Yeah.
You know?
As far as filler goes, because we all are fans of filler. We have none, of course, but
I've heard about
it. Yeah, I mean, we help people all the time with it.
Asking for a friend.
Asking for a friend, yeah. So talk about filler, because I don't know, we love it and it's so cool what you can do with it. And just like talk about, like, I know we love cheek filler. Like just talk about kind of like, you know, for filler novices,
Small
like where
changes
you
over
can
time.
put it, where you can put it, what your techniques are, how you approach a patient that wants filler.
Yeah.
And like all the different areas you can do and kind of how it benefits.
Well, first of all, I know you're not going to talk about this, so I'm going to talk about this. Adrian is on faculty for Allergan.
Nice.
Yes, for filler. Adrian is a master injector.
Listen, big shout out to all my girlfriends from day one who were like, yeah, I'll let you inject me.
Sure.
Cheers to them.
Cheers to them.
Cheers to the
Thank you.
original
All of our
Black Diamond
first
crew.
patients.
Yeah. Thank goodness they were just.
No, but I'm serious, Adrian. That's like
it
a
is.
really
And
amazing
you are very
accomplishment.
humble. You never tell
And
anyone
you are very humble. You would never brag about
Yeah.
it, but I'm going to brag for you.
Well, I appreciate that. I am very obviously passionate about the teaching of newer injectors. And like I said, more is more. And the more people that are doing it very well, the better for all of us.
For sure.
Right.
I mean, the better for all of us.
Yeah.
Nobody wants to have a complication. It's going to happen.
Yeah.
I love seeing somebody, I'm like, who did, your temples? Those look incredible,
Your temples. I didn't even know that was a thing.
I know, you need to educate.
Did not even know there was a thing.
Filler go. Just
Peanut
go.
face.
Filler goes, so here's what I want you to think about. I want you to think about your face when you liked it the most. For most people, they're like, oh, like when I was like 25 or something like that. Not for me, but like for most people.
That was 8 faces.
8 faces ago. Yeah. So most people have a certain time period when they like
Those
their
are
face.
her words, not mine.
Yeah.
Oh, yeah.
my gosh.
I didn't know
no,
her
I
was-
have an annual face change. Tomorrow might be the 2024
Actually, you
version.
did say you wanted filler tomorrow.
Yeah, we're gonna.
I'm dying. Wait, you have to say, what do you always say if you go
Yes,
missing? You
yes.
have to say it. It's hilarious.
If I go missing, you have about 30 to 60 days to find me, because I will not look like myself after that point. You're gonna have to go find a high school photo, and she ain't the same.
I love that. It's so true for all of us, honestly.
So I always tell people, you think about that image of yourself when you liked your face the most, right? Like, and it's always a looking back. So is it like 2025 is because you had all the volume and you didn't have lines and all that, right? And you start to notice like little shadows, shadowing through the temples and maybe under eye, and like, maybe there's extra down here now and like little shadows down here. Filler is meant to replace lost volume in areas where you previously had it, or to hide it in areas where you have volume now. So you don't ever add to an area that already has volume, okay? You, like when you put your highlighter on for makeup, you're like, I don't do that.
I don't do that.
I saw that.
I'm like,
That just seems like a lot of
all I
work.
have is sunscreen and blush.
Yeah. Okay, well, that's perfect. So
That's
you put your blush
amazing.
through here to give you a little life, right? Right?
I
Blush
try.
You look
equals
amazing.
I try to put
no one looks like a
concealer.
corpse. That's why we put blush on. But we do it because we're bringing like life back to the cheek here. So we can do the same thing with filler. And people get all weirded out about filler. They're like, oh my
They
gosh.
do.
Well,
Why?
can I tell you why?
They're like, well, you don't have any filler. Well, no. If you look good and you just think someone looks good, it's because they've had filler and it's been done well.
Do you want to know why I haven't had filler yet? It's because my dermatologist, who I actually really love, but he told me, he was like, that filler never leaves your face. It is there in MRIs for years to come.
That's fair.
So it kind of freaked me out, and then I didn't want it.
But you can also
So-
dissolve it if you don't like it. That's why I like it.
Because I know that you are a little research nerd like I am. Yes, that is true. There have been multiple studies that show that little filler particles will remain. Now, as science has advanced and the way that they link these hyaluronic acid chains has advanced, it is less likely to remain over time.
If you do one with more hyaluronic acid, like you
They're
would
all
think
going to be
hyaluronic acid just draws
It's
water
really,
in.
it's kind of essentially how they're cooked.
Yeah, but
It's
hyaluronic acid
cross-linked. It's like how they're,
okay.
how the
It's
chains are put
how
together.
those chains
Okay.
are linked, either long or short chains. So, we are personally venturing a little more towards the hyaluronic acids that are most like your human HA. But that isn't to say that your body's not going to recognize something foreign. I mean, to be very honest with you, long term, you might have a little particle here or there. That it will be the least of your worries.
Yeah.
That will just.
But what about people who are doing it really young? And they're starting really young with filler, and then they just keep going and going.
Well,
is that a risk? I mean, I don't know. I'm asking
No,
because
I mean,
patients
I
ask
would
me,
just
and
say
I don't know.
that's where you want to go to a good injector who if you can be young and have thin lips.
100%.
Right? So what are we actually talking about?
100%.
Is it a young person who's 24 and
Yeah.
somebody just wants to inject tear trough filler and they shouldn't have it?
Yeah.
do they still have a youthful face and they just want to look like they've had plastic surgery? So I think you have to look at what they're asking, because we've had many people be in their 20s who are like, my upper lip bothers me. I get it.
Yeah, for sure.
Yeah.
We can change that for you.
Yeah.
So
That is true.
A lot of it is genetics too. The unfortunate thing is, by 30, some people are really starting to see age that is happening, and it's really bothersome to them, especially if they are among peers who aren't seeing that yet. And, I always say, it's now, growing up, the analogy that I tell people, I was never allowed to step on that softball field.
Here we go, guys.
Here we go.
We love Adrian's analogies.
I was never allowed to step on the softball field with my jersey untucked. And my dad would always tell me, you look good, you play good. End of story. Like, that was it. And, I just wanted to be cool with my jersey untucked. But the reality is, you look good, you play good. And that transfers into later in life.
Sure.
So if you get up in the morning and you feel
100%.
confident, you handle your day a little bit differently. You have a confidence that no one else needs to know about, but you look good, you play good. So yeah, that was
Sean Ray.
I know.
God, I love that.
let's
Another
cheers.
Cheers.
Sean Ray.
But it's the truth.
I love
It is the truth.
And don't be afraid of filler. Overdone, anything overdone is
The only
is
thing I'll say
bad.
to be afraid of is addicting. Because once you start, you're like,
I
oh
would
wow,
like to
this
know.
looks amazing.
Like, what else besides the face? Because I've heard you can fill a neck.
Yeah, there's
Like, what am I filling in my neck? What are
Well,
some
you
things
don't-
that you don't think
I
about?
You
feel
don't
like
need filler in your neck.
No, you don't. But I feel like eyes and neck are the two things that show aging the most. And like, I feel like they're the most difficult areas to treat, sadly. But that's probably why they show age the most.
Well,
but
PSA, guys, whatever you do to your face, do to your neck.
Oh,
Like, you can't say it enough. Skincare.
Yeah,
Starts with
million.
skincare.
floating head syndrome.
Yes.
Yes.
SPF. They're like, I don't want to pay for my neck. I'm like, you're going to look dumb in 10 years.
It is
Actually,
true.
then leave. Because you're
floating head syndrome.
You see these people who look like they've had their face sandblazed,
They're-
blasted
Yeah,
off, and
it
then
is
they
so
like
true.
show
Their
up and
face, their skin is completely discolored.
like you had a face transplant.
Yes.
yeah.
Well,
Okay, so Morpheus on the neck.
Morpheus is amazing on the neck.
Yeah.
Halo's amazing on the neck.
Oh, that
I'm a huge Halo fan. I love Halo.
filler can be beneficial in the neck. A lot of what you are seeing are the biostimulator fillers that are stimulating your body to make its own collagen. So in the neck that's showing laxity, we're stimulating that skin to naturally make more collagen and elastin, so it looks firmer. You can also place directly place a fine filler in there to hide some of the lines. So
I'm actually going to do it for my
That's what I have a lot of lines
you'd
across.
be an easy one.
Yeah.
But I know
You would be
Adrian's
easy
dying to
button,
do
yeah.
these.
Oh, I can't even look
She
at it.
hates these.
What would you use for those Botox?
Oh my gosh.
Because anytime
That is like the
I never-
perfect.
Yeah.
But I never knew I had
Take
a
her to a
problem.
training.
I will.
Yeah.
I look at her and I'm like, she is just perfect. And then she
Do it.
smiles at me sometimes,
Do
and I'm
it.
like, I'm gonna grab a hold of that.
Platismal banding.
And now
toxin in
anytime
there.
I take pictures, I'm like, oh, my neck. I'm like, my neck never bothered me until
So it's your platysma,
I know, because I get so excited.
and it's fine, and that's fine.
And when I get really excited, my neck
And a lot of people have a strong platysma. All you need is a little bit of neurotoxin in there.
Like a small amount.
So here's the other.
Baby talk.
Here's the
Baby
other.
That's a buzzword
Like a
now.
baby
Yeah.
talk.
People feel
Baby
better
Botox.
about it when you're like,
they do.
baby talks, like a mini tummy tuck, baby Botox.
Well, and we have to be fair and say we're using the word Botox, but like it's all neurotoxin.
all
We
neurotoxins.
use everything.
I actually love
Tell me
Xeomin.
about the-
That's my favorite neurotoxin.
We just got a new shipment in.
I love
Healthy
that. I will be scheduling an appointment.
Tell me about the healthy neurotoxin.
Xeomin.
My patients
The
ask me
organic
about it.
Xeomin. That's
like
what I
Crunchy
use.
neurotoxin.
Crunchy neurotoxin for my patients.
For
That's what I
people
use.
that love kale.
Yes.
Yeah.
Kale
Okay,
lovers.
So here's
have a
what
Botox
you need
kale
to know.
toxin.
Kale toxin. It's called Xeomin. It is exactly identical to Botox.
I love it.
It has everything. It actually are the same patent. They're everything the same. Botox has a preservative that Xeomin doesn't have. Y'all, it's still botulinum toxin in your face.
That's
So
what I tell people.
you
It's
know,
one preservative better
what
though.
it,
I mean, but it still needs to be
Saving the world one preservative at a time.
I'm just saying.
Whatever makes you feel
No,
better.
I just like the way,
it
I've
goes
tried them
away.
all. I don't
Yeah.
really care about that. I know it's so similar, but
lot of people
I like
like
the
the
way
feel.
it feels better. Like
Yes.
Botox always felt really heavy to me, and everyone's different.
That
like
is true.
people
For
love
me
it.
too.
I like it feels a little bit lighter,
Yeah.
and I don't feel as frozen or like heavy. Like my fur doesn't feel heavy, so
Yeah.
that's why I like it.
I can say, I just hit my mic, but I can say, and I'm not sure about you, but I have people that use every toxin we have. And I love that we carry everything that is on the US market because certain people feel better with certain ones.
1,000,000%.
It's just
So
more
what about
tools in your tool belt.
what about
That's right.
Daxxify?
And
Let's
that's
talk about that because that's new.
Yeah.
So that's a fun topic.
I actually really like Daxxify. I think it's a great product when it's used correctly. The price point coming out the gate's a little bit higher for people, so they're a little afraid of trying it.
What?
For those of
Understandable.
for those of us who have no idea what you're talking about, Daxxify is
It's
a
another-
Botox, a filler.
It's actually
Botox.
Daxybotulinum toxin.
And-
It's another
neurotoxin.
Because
it's another neurotoxin.
It's supposed to be
makes your
longer
wrinkles look better.
Yeah.
for longer.
Yeah.
But they say it makes your skin look more glowy.
It does.
The studies for Daxxify studied not only duration but also skin quality. So
Well, it was
does
supposed to
have,
be a topical.
Yes. It was supposed to be a topical.
It was supposed to be like a rub-on.
Ooh.
Because
at
And
me.
then they decided to inject.
Well, then it didn't work.
Oh, okay.
so they thought,
Let's still inject it.
Yeah, it doesn't work topically, but let's inject
But our
it.
skin will look great. And it's called the Daxxify Glow.
And
it's
I've
a
seen
real,
it.
It's a real thing.
I have
I
seen
feel like I
it.
see it with all Botox though.
No,
Well, I mean,
it's
to a
different.
degree.
When I
To a degree.
It's
non-preserving- What
different.
is it? Xeomin? I feel like
No.
yeah, it's shiny.
It's shiny.
I
right?
agree.
Well,
That's
just because your
shiny.
skin's
different.
flat, right? You don't have
And
the...
no sweat. You told me that.
Yes. So here's the difference with Daxxify. It is coupled with a peptide, which allows more of the toxin in their studies, allows more of the toxin to adhere to that cell receptor site.
Okay.
But the peptide also improves skin quality. Yep.
And
I
it
love science.
I have
Magic
I just
peptide.
love it.
I have had
Now
friends
I
that
want
it
it.
lasts longer in, but it also kicks in quicker.
It does have a
Yes.
faster uptake.
So it's really interesting. It's kind of cool.
Well, that's why it's nice to have
everybody's
these different
yeah.
options,
I
you
think
know?
you need to try and like figure out which one you like, honestly, because that's what I did, and I found the one I like.
Yeah, absolutely.
Can we talk about other places you can Botox?
I love the off-label stuff.
Because
It's crazy, all the different places.
I was at Oklahoma and I did sports medicine. We had a really good pitcher. I don't know if I can say her name. She's
Let's
really
don't.
good.
Let's
HIPAA.
Okay, I won't, but she was really good. You know who you are. And she had really sweaty palms. And so we talked about Botox for the sweaty palms, but we were a little bit nervous because the last thing I want to do for a
For
pitcher
her
is
throwing, yeah.
change any kind of muscular strength at all.
Yeah.
But anyway, so some of like the off-label Botox.
So for hyperhidrosis, it is wonderful. I can personally attest to that from an axillary standpoint. It is life-changing. I have dealt with this since being a teenager, and it is mortifying, and it's limiting, and you think about it day in and day out. And it's the same for hands and same for feet for some
Feet.
people.
If you see people
Yeah.
that have hyperhidrosis of their
Yeah.
feet, I mean, we have a patient in our practice right now. I know Paige was talking about. She was like, I have to keep towels out for her.
Yeah.
Her feet are dripping during a treatment. Like that's truly life
Debilitating.
changing.
It's
Life changing.
Yes.
So
Yeah.
I am a personal huge fan of Botox from that clinical perspective, using it for hyperhidrosis. It doesn't inhibit, if it's placed correctly, motor movement in the, because it's only, if it's placed at the
Just in the
depth
dermis.
that hits the sweat glands, it will help with that.
This is why you shouldn't have, because like they asked me if I could do it, because they just assume you're a doctor.
Yeah.
You can do it. And I'm like, no, thank you.
Yeah.
It's like doing,
You need to go to someone who
100
actually
little
knows what
TB
they're
tests.
doing. Like,
all
Yeah.
it is.
it's not me.
It is.
Yeah, it's 100
Same
little
needle
wheels.
too. Same
Yeah.
syringe.
Yeah, that's all it is.
It's so fun. I love it. That's
I
like
love
my
doing it.
microsurgery background where I'm like, oh, I get to do someone's
Do you want to do my armpits?
Yeah.
They
I'd love to. Just make
Fun.
sure you shave.
I mean, let's try. Every time I give a talk, I sweat. And
It
it's
is-
really bad.
Life changing. I'm telling you, it is such a game changer when you don't have to worry about, I can't wear a gray t-shirt or I can't wear this because I'll sweat through it. Like, it is absolutely a game changer.
Or you look in your closet and you're like, I have glitter pits.
Yeah.
Glitter pits, and you have to throw the shirts away
Yeah.
because of the deodorant.
So back to the off-label,
Oh, are
because
you going?
off-label fascinates me, and I want to talk about off-label filler. But let's stick to off-label Botox since that's what we were talking about.
I I don't think it's off-label, but I want to say I had a patient who came in who had seen her chiropractor, and her chiropractor sent her to me for headaches, like to do a food thing and all the things.
Migraines?
Yeah, but then when I was talking to her, she had morning headaches, and I'm like, if you have morning headaches, it's
TMJ.
pretty sure it's because you either have a brain tumor or you're grinding your teeth. Like 99% of the time it's because you're grinding your teeth.
Yeah.
And I told her, I'm like, are you a grinder? And she's like, I am a grinder. And I'm like, the easiest way to tell if that's what is causing your headaches is to just get the Botox. I'm like, I know it's expensive to do your blah, blah, blah. I'm like, just get the Botox. And so when I talk them through, and I love my patients to see our practice because I know that we don't do things unless we need to. But I just tell them, if you're going somewhere else and you're getting TMJ, make sure they're doing every place that you're supposed to. So you guys have taught me, like, it's not all about your masseter, like
Temporalis,
it's about the
occipitalis.
And so, like,
Not for
when
teeth
you
grinding,
do
but
it,
like
though,
for true migraines.
100%.
Yeah.
And there are, so, yeah, and we don't have to get into this, but if you have patients who do really well with Botox back here, they're really good plastic surgeons who are specific for that surgery.
Absolutely.
To help, if you get relief from Botox in your occiput, really good surgeons
Yeah.
purely do that. And that's what you want. So, I don't know, you can just use it as diagnostic tools as well.
Absolutely. And today I did have a patient that was talking to me about, she wears a bite guard. She's like, I've never tried this before. I'm just curious. We did a very low dose in the lower part of her master just to see if she gets improvement. And she was fairly strong throughout. If she gets improvement, then we know that moving forward, we are going to go through fully dose everything, and we're going to make a difference for her.
And I have patients who are like, well, no, I am fine because I wear a bite guard. I'm like, no, that only keeps you from cracking your teeth.
Yeah. So
It does not keep you from grinding. You're still going to get the headaches.
Yeah. If
So
you
that's-
wake up and you feel tired, or those muscles feel tired, or like at the end of the day, like you can feel.
If you do
the
this,
fatigue.
if you
I have
find
a
yourself
patient that has point tenderness. She's like right here, right here, and it's all like anatomically
That's
perfectly
crazy.
correct. And she told me she cried. Like she came back in, she was like, this was life changing for me.
That's amazing.
And to jump through the hoops for medical Botox or something like that, the migraine thing, she was like, I didn't even have the energy to go do that.
Yeah.
You know? And she's like, it's, you just have to listen to the patients, know your anatomy, and then
yeah,
it all,
for sure.
when
Know
it
your
lines up,
anatomy.
it lines up.
And if it is somebody that comes in and I'm like, you know what, you're more neurology than what I'm going to do here, I'm going to send you somewhere.
Refer
out.
Like I'm always going to refer out if somebody has a bigger, better deal.
Yeah,
I'm
for sure.
always going to refer out.
Yeah.
And I appreciate that about our practice specifically is that like I just want the best for you. Like and I sit down and I tell people all the time, like, I don't care what we do in here. I can treat you or not. Like,
Yeah.
That's what I tell people all the time.
And you'll find somebody that will do it,
Yeah.
but it won't solve your
1,000,000%.
problem.
right.
But I tell patients, like, our providers are going to get paid the same, whether you get 0 Botox units or 100 Botox units.
It's a really important distinction.
We are not paid based on production.
1,000,000%. And most offices are.
I haven't heard of another office
Yeah.
besides ours.
Yeah.
That is
doesn't
not-
at least get some form of
For sure.
compensation based on
Their production.
patients
Hitting
or
numbers
production.
even.
Yeah.
Like you guys don't even get it. If you hit a number, we get extra money. It's just, you're just there solely to do what is right for the patient. You're not incentivized at all. And I think that is, I don't think you would do anything differently because you're amazing people. So I think even if you were, you'd still recommend the same things. You'd recommend what's right and what's going to actually help them and no more than that. But I think that's a huge differentiator, and I love that.
If we want this to be seen as a branch of medicine, then we cannot treat it as a commodity. Then we're just not going to do that. And if we see numbers, here and there of what we're doing and whatnot, at the end of the day, you still have to pay.
It's a business.
It's a business.
Yeah, I mean, obviously
Let's
we
not
want to
say-
do
yeah.
better each
Yeah,
year,
right.
but
Like at the end of the
but
day,
you're not
there's still,
incentivized.
and there are
to
things
do
that
it.
we are going to do to be able to reach more people with our
We got to
services.
keep the chandeliers on.
Yeah, we got to keep the cup full, the hair in, like we got to keep it. But we work really hard to make sure that we don't make choices for people based on that.
Yeah.
And if we want it to be seen as a form of medicine that is respectable, we can't treat it as just a tippable service.
1,000,000%.
So
the other thing that I love too about not working off of, commission or productivity or whatever you want to call it, I think people spin it different ways to make it sound better, but at the end, it's all the same, right? The collaboration, I think, between our team makes us so unique.
I love
because we're showing pictures. We're like, hey, what would you do for this? What would you do for this? If we were competing for patients in our own practice,
1,000,000%.
I'd be like, pull my screen towards me.
Yeah.
I know what I'm going to treat her at, and I'm not going to ask anybody else, But, and to your point of being collaborative with medicine, that's how you do rounds, right?
Yeah, for sure.
Everybody's
Absolutely.
bouncing things off each other.
And we all
like,
get better.
So it's like,
What's best for the patient?
For sure.
it is.
Yeah.
And so we are constantly discussing things like, what do you guys think about this? What do you think about this? What would you do for her specifically? This is her complaint. Like,
I love that.
yeah.
I love it
love
so
it.
much.
that's something very specific to our practice that I have not heard that anywhere else has done well, at least yet, is you don't just get like my years of experience or Stacy's years of experience. You get everybody's years of experience. So
And you have 2 surgeons if needed.
and we
amazing.
absolutely touch
Yeah.
base with them on ideas and things that we need to work on. And if I see somebody who we do see numbers here and there, and if I'm like, oh wow, like this person hasn't had the chance, and it's not about ability because everybody that works with us is so
they're all
above and
great.
beyond.
Yeah.
Like the fact of the matter is you have to be qualified to be on the team.
1,000,000%.
You have to be.
I think
And-
you guys know you don't survive in our office.
No. Well, we're really hard in the interview process, so we only hire the best. And I love that you guys are so collaborative. Having been like a patient on the other side of it, and obviously I'm not medically trained at all. I'm the only one at this table that's not.
I beg to differ, Dr.
I have my doctorate from Google, but other than that, I can tell you, like from a personal perspective, I went to get my first Botox treatment, and I listened to a friend and went to a very well-known practice in Columbus, actually, very respected practice
I don't know
in
if
Columbus.
I know this story.
And it was my first Botox treatment. I was maybe 32 years old, so I wasn't, showing massive signs of aging yet. And literally I just trusted them, and it makes me die inside. They did like just under $800 worth of Botox on my 30-year-old face.
Oh, I believe that.
And I have never heard of a patient in our office doing $800 of Botox that I've ever seen or quoted or talked to or whatever.
What does that mean in units?
I mean,
I do
80
have-
units
I
back
do
then.
have
It
some
was probably
people
10 a unit back then.
that
So
do
about
it.
80 units.
I do have
But I
people
was
that do
30.
that.
My gosh, I'm 45 and I think I
So
got 28.
I couldn't move my face.
Yes.
And I hated it. And it was way too much. And I never did it again until I started working for us like many years later.
Well, I think the
So-
point is that when you're trained from an injection standpoint, and I don't know how it was for you from a training perspective, but when you're trained,
More is more.
more is more, and that they're not going to be happy with anything less than more.
Yeah.
Or you won't deliver the results.
Yeah. And I think if you are educated in anatomy and you are really taking the time to get to know your patient, that you can deliver a really great result that they are comfortable with that isn't necessarily more.
Right.
So much more.
I had a patient come in today, new patient, my last one of the day, actually, before I came here. She lived in Chicago. She moved back. She's from here, whatever. She's like, I just got Botox. I've been going to my friend in Chicago. Friend.
Yeah.
Always a friend.
Always a friend.
Everybody has
Always
that
a
Botox
friend.
friend.
Yeah.
And she's like, I've been getting 60 units. And I looked at her, I was like, wow. I would recommend starting at half that. So I said, if you want me to do 60 units today, I'm game. I have 60 units in my little fridge I can pull out for you. But I would never, for you as my new patient coming in, tell you you need 60 units. So I think that's to your point.
Yeah.
And I said, now you come back in 2 weeks. We can always add more.
Yeah.
But when you say you were frozen, That's how people stop. That's why they stopped doing it.
Yeah.
Because
I hated
it's like,
it.
It's
I
like
didn't even look
baby
like
steps.
myself. I didn't
Right.
even look like me.
Right. And that's what people are scared
Yeah.
of. And those are the stories they hear.
Yeah. Yeah.
That's what I love, that our like family always just lets you come back.
Yeah.
They're like, we're going to do a little bit, and then if you want more, just contact us.
I literally
And we'll
couldn't
come
work
back.
at this office if we didn't
Which
take
is
that approach.
huge.
Like,
I
mean,
am more worried about your results than you are. I promise you.
Well, that has
That's
your name
true.
on
a
it.
million percent. A million percent. And we always follow up with new patients and check on them and see how things are going, which I love too. Back to like off-label Botox, and then I want to get into filler, but I do want to hit on Trap Tox because people have been talking about it.
That's off-label.
Barbie Botox.
In an aesthetic space, it is.
Yeah. So what is it exactly, and does it work?
Yes.
Yes.
It works.
And where do you inject it, and what is
Just
it?
in
What's
your
the
trapezius
result
muscle
in
here.
that?
So I hate saying like Barbie Botox. Like I
Okay.
have a
Don't
daughter,
you?
right?
Yeah.
Like
What does that even mean? I want
it just means you look like I
Where's
know.
Barbie? Where's muscle Barbie in it? With some biceps and triceps. She's got some traps up here.
She doesn't exist.
Why is she so
don't.
skinny with a teeny weeny waist?
we need to like
spend a
develop
lot of
that.
money
Not
per
compatible
month to
with
like
life.
build
Yeah.
my
No,
traps.
that's not compatible with
But for
standing.
some people,
Yeah.
the way that muscle shapes does not give them the neckline that they
Like
want.
a feminine.
It
like
looks like
lower
kind of like
neck.
hump, like
It's
a
a
hump.
little
So
for some
does it
people, it's-
elongate the neck then? Like it's soft?
not the
like,
neck,
Okay.
like the shoulders.
Yeah,
Like,
it's just like
It
softens it and
can
relaxes.
give the appearance of an elongated neck. It doesn't elongate the neck. I guess
Okay.
that's the best way to describe
it.
it. So the little bit of like the bump that you get through here from an overactive or
From your
hypertrophic.
levator.
Yeah.
Yeah.
But it's a really important muscle.
So
you're so functional.
oh my
Just
goodness.
mean like it's an important
See what I did there?
muscle.
You're amazing.
For some people who don't
It's
use
just
that
a
often,
little bit.
they do like the more slender
Yeah.
neckline that it gives them, and like the just the less bulky
Right.
shoulder area overall. So it is injections directly into the trapezius.
Interesting.
Yeah.
Do you feel like before you came here, you had a stigma about filler and Botox?
Surgery.
And surgery and plastic surgery. And now that you're here 2 years later and you know myself, you know Adrian, how has your perception changed?
So before I
And
started,
I want like brutal.
This is
I want
super
Marguerite
honest.
Weston on a Saturday night.
Not
Okay.
Dr. Weston, Marguerite.
No.
Let's hear it.
Yeah.
So before I started, I had seen a dermatologist and had Botox prior to. So I had Botox 2 times before I started with you.
2 times, not just one, 2 times.
2 times. Right here. Because I looked in the mirror and I was like, oh my gosh, I see my mother. So I went to my dermatologist, who I love, and I was like, this needs to go. And so he helped me with that. And then he's going to tell me about fillers. Then I've been apprehensive about fillers, so I haven't had
Don't
any.
be. I'm telling you.
But when I first got the call to start here, I was a day off because I have kids. So like I have a day off and
Your day off.
well, at Ohio Health, I was at Ohio Health. And so it was technically my day off, and I have my kids at home.
That's what I'm saying though. Your day off.
No, I know we don't really
Go
ever
with
have them.
it.
So then my secretary is like, this plastic surgeon wants to talk to you about a patient. And I was like, get on my computer. I'm like, stupid plastic surgeon. And I get on my laptop. I'm like, he probably didn't even read my pre-op note about them. I probably already cleared him for surgery. And then he said, we've been thinking about functional medicine and we really want to help patients from the inside out. And I'm like, okay, I'll meet you. And I hung up the phone, and my husband works from home, and I went in and I'm like, this plastic surgeon wants me to come in, and I'm like, there's no way I'm working in a plastic surgery office, ever. And I came in, and I'm like, I walk into our COO's office, and he came in, and Dr. Donaldson, our owner, and they just really care about the patient from like the inside out. And they're like, we don't know what to do with patients who don't need surgery, but don't feel good. And I think you could be the answer. And I'm like, I think functional medicine would be amazing here.
Yeah.
And then when I did some research, I realized that 80% of patients who seek out plastic surgery or aesthetics also seek out functional medicine.
That's amazing. I didn't know that.
I didn't know that.
80%. And it's because if you think about it, like a lot of patients who seek that out are health conscientious.
Yeah.
Like
Well,
it's
you
not
care about
about
the
the
outside
outside.
and
You
the
care about the
inside,
inside too.
Yeah.
Like you don't usually have people who are eating McDonald's every day and not exercising at all, going for plastic surgery. Like, it's people
Well, and
who
when you're
care
spending
about-
all the money to
100%.
do the surgery, you want to maintain those results and, feel healthy and feel as good on the inside as you do on the outside. I want to talk off-label filler because that's fun, I think.
Let's do it.
There's so many cool... Oh, really quick, I do want to touch on the Botox in the chin.
Oh,
That's
That
my
changed my
favorite.
Suddenly we're a fan.
Oh my gosh.
such a fan of
So talk about in the chin because I think I didn't know about it and you guys did it the last 2 times. So I'm like, this is amazing. So talk about that.
So the term off-label is a little overused.
I know, sorry. I just
No, you're
it's not
fine. I'm just
I just
saying,
think
in
Botox
terms
is
of-
standard here. Like
Correct.
people think of it
Of
here.
all
so.
the neurotoxins,
My derm won't
Botox
do
is
it.
the only one that has indication in all 3 areas from glabella, frontalis, and crow's feet. All the other neurotoxins only have glabella. That's all they need. Anyhow, we use them everywhere.
Yeah.
it's because every other company is not as monetarily well off
Yeah.
to make all the
yeah.
clinical
Pursue that.
phases
Got it,
for
got
the
it, got it.
trials. So they're like, okay, we got the glabella.
Yeah. Got it.
So over the last couple of years, I think we have been utilizing Botox, any neurotoxin in the lower face a fair amount more. And I love it in the mentalis. In fact, most of my patients are recommended, if they are candidates, to get mentalis Botox. Yeah.
I love it. What does it do?
I'm one.
Essentially.
You can get like that,
Yeah.
like orange peely looking chin.
Yeah.
And so it can just help kind of relax that. It also gives like a new shape to your chin almost, right? Like it relaxes it so there's more projection too, so you get better facial balancing.
Agree.
So I think when you do filler in the chin, which is like my new jam, I love chin filler, love chin filler. When you do that with a little neurotoxin in the chin to help relax that and let that filler settle.
For
So
me,
good.
along the TMJ lines, because I have bad TMJ, so I clench and I'm tense here, and I feel like I tend to like pull my bottom lip in a lot, just because that's just how my face works. And when you do it down there, my bottom lip's always relaxed, so I feel like it makes your bottom lip look more pouty too, which is
can.
kind of nice.
Yeah,
It can.
which is kind of like the lip flip,
Yeah.
right? When we do it up here.
What is a lip flip?
It's so overrated, I think. I mean, we've been doing it for a gummy smile
is it a-
for 10
is it a
years, and now
Botox?
TikTok people
I
come
know.
out
I
with
feel like I
Botox.
throw my
Because my
sword
derm
down
said
every
you can't
time
do
people
Botox
come.
from here down.
Who said that?
My derm. And that's why I was so nervous about
Your
the chin.
derm also
and then
told you that
you
you
fixed
couldn't
my
have filler.
chin, and it was amazing. I love my new chin.
Hope there's not a bridge nearby that your derm's got opinions about jumping off of.
He's really good for
Derm.
skin cancer.
Yeah, there you go.
And
Weird.
dermatology.
But yeah, you can
His
do
line
Weird,
of
that's
work,
his
you could do a lip
specialty.
flip.
He
Stay in your lane.
Just preaching to the choir there.
Okay, so let's get on the off-label like filler, because that's you can do some fun things with that.
Chin.
Chin, lower face, completely. Temples, like everywhere back. I mean, some of the fillers are on label for hands.
Neck.
You're frosting a cookie, right? The more ornate you make that cookie, the more filler you have. That's really kind of where we're at. So people get freaked out by number of syringes. It's a fifth of a teaspoon if you do one syringe.
Yeah, it's nothing.
You're not getting very far with that. So, if I recommend a syringe or 2 to you, I promise you I am not trying to make you look completely wild.
What, because you guys, this is like a fairly kind of new thing, but what about like the whole temple thing? What is that about? Like
I love it.
Yeah, peanut head.
Oh gosh, Mr. Peanut walking around.
Get it?
yeah.
Like,
Nobody
like
wants to
head.
peanut
I
head.
know. My friend came for to train, I think, with that, and I did not know that was a thing. So then I'm in the mirror and I'm like, do I have peanut head? I don't even know.
If you have to ask, you don't have it.
Yeah, I would tell you.
Yeah, you'd be like, no, wait, I'll walk in and I'll just be like, what do I need?
Yeah.
Like, I feel like
Yeah.
I don't feel good. Like, what do I need?
We've fixed your peanut head.
You had a
Yeah,
peanut
except
head?
I had the weird vein thing.
Yeah, I did
so,
too, though.
Yeah,
Yeah.
so we couldn't do
temporary.
very much because
We just- you didn't
There's
need
big
very
vessels
much.
there,
Yeah,
so make sure you
I
have a good
have-
injector.
I have really big vessels there,
sure.
so it like it was
Yeah.
we couldn't do a whole lot.
It's good though that you can see them.
Yeah.
That's helpful.
Yeah.
Yeah, but some people do great with just a little bit. It
Yeah.
just helps soften
Yeah.
some edges.
It does.
So, yeah, so you can do temple, you can do jawline, you can do chin. I mean, it depends on the product. Lips are off-label for a lot of products. Nasolabial folds are off-label for a lot of products. Back of the hands, that is a big area that we see aging. That's an easy place to drop a little filler. It'll just make it look a little more youthful.
And no one's like
and the buttocks.
And the butt.
Let's not forget it.
The buttocks.
It's, you know,
I love that.
and the buttocks. All right, so talking about all of this, obviously the number one thing everyone has to do, because we always say this, if you can do all this and spend all your thousands of dollars or hundreds of dollars, but if you're not using good skincare, like what's the point?
Yeah.
Right?
So true.
So everyone always asks me, and they ask me, so I'm going to ask you guys. So asking for a friend, what like are the top, like what do you, like what are your top 3 skincare products that you like love to use?
Like brand or just like
In general.
the top
Just in general.
3 things
In
you
general.
have to have.
Yeah.
You have to have a good cleanser because your face is dirty. Whether or not you put makeup on, it just oil, whatever.
Right.
Good cleanser. You have to have a retinol. You have to have a retinol. Evidence-based medicine over like 100 years now is like vitamin A.
What's your retinol you use?
Alpha-Ret.
That
from
like
Skin Better.
Oh, that overnight one.
That's the only one I can tolerate every
What's
night.
the one with the numbers?
Tretinoin,
Yeah.
like
But what's the
point-
one?
Oh,
0.25.
Environ.
No.
Yeah.
Yeah, the Environ
Oh,
sequence.
the sequence serum.
But that's not
Yeah.
retinol though.
Oh, it's not?
There's not, is there A in that? Or is that technically a retinol? Or is
Yeah.
it, oh, it is.
It
Okay.
is. There is definitely
Didn't know
retinol in that. And it,
Got it.
that's kind of like tretinoin going from like 0.025 to 0.5 to 0.75, like that kind of thing.
And you do any retinol, retinoid, or tretinoin, you want to start low and increase so your skin can get used to it.
Yeah.
Okay.
And then my last one would be an SPF.
So I love this question. And I always say this to patients. Like, obviously, we work in an amazing industry and we get a lot of perks because we get to try out. We don't want to do anything we don't try, right? And so we get to do all this fun stuff and try these things, you know, and we're not paying full price for them, obviously. So I always love to ask, and I get asked this a lot, if you did not work for the office, okay, and you paid full price for one thing a year,
BBL and Halo every fall.
what would it be? Same. That's
what I wanted to
my
talk about.
answer. I would do Halo BBL every fall.
Adrian would do lip filler.
And neurotoxin. Lip
Well, you
filler
only can
and then
pick one.
neurotoxin.
I would pick Botox if it worked for me.
You can only pick one.
I would pick Botox over the Halo BBL. I say Halo BBL.
I say
because-
Halo BBL. I love it. It was life changing for me. Like
I can only pick one between a neurotoxin and filler.
Yeah. No, we did this on TikTok or whatever. it was
drum
the
roll.
other day.
Oh, what did you pick?
I chose Botox, she chose filler, and I'm
I'm
immune to
choosing filler.
Botox.
Yeah, you're
Oh,
choosing
yeah,
filler.
that was
Okay.
bad.
Filler.
I knew you would choose
Yeah.
filler.
I would do
Who
Halo
would I be
BBL.
without it?
So really quick, we
don't
have
know.
Oh my gosh, that's a really
2005 will
deep
tell you.
question.
We've talked so much about Morpheus, but like Halo BBL, let's touch on that really quick.
Yes.
So explain
Well,
what
you
that
tell
is.
me. You tell me. What have you noticed with your Halos and your BBLs?
So BBL is broadband light,
Correct.
and it treats browns and reds. So if you have vascular skin or like hyperpigmentation, it's going to treat that. And doing doing it in combination with the Halo, which is an ablative laser, it actually does tone, texture, fine lines, wrinkles. Like it can like maybe tighten a little bit, but that's not for that. That's more Morpheus. So it treats everything, like every issue of your face, and doing them in combination is like really profound. Like your results really magnify.
So proud of you.
You're welcome. But I actually listen to you guys. Do you believe that? Like I know you think I don't, but I do
That was
listen.
wonderful.
And I'm a surgery girl, so I shouldn't know crap
Yeah.
about that
that's
stuff.
true.
So
That was great.
But I also don't do anything I don't believe in. So I anyway, but I believe in it because it's literally amazing.
It's a game changer.
It's a game changer.
You talk about your experience with it because you were like,
I've had it twice, every fall for
Yeah.
for 2 years, and I absolutely love it.
Yeah.
But so like I don't have all the
Yeah.
but I just knew that I had sunspots,
Yep.
and I was like, I just knew I had sunspots, so I just went in and had that, and then my sister, who's ever so honest, she was like, you should get your neck done. So I did my face, neck, and chest. Mm-hmm. And so you can't really tell when you do it on you unless you take pictures, like the change that you have. But then I had it in the fall, and then I saw my sister that like spring, summer, at my mom's, so I had a bathing suit on. And my sister was like, your chest looks amazing. And that's an odd comment. And for those of you who have met my sister, she's rather honest. So she would not blow smoke up my butt at all. And so she's like, your chest looks amazing. I'm like, I guess it was laser 6 months ago, but that's what it did.
Yeah.
And so it's been like transformative here. And then I didn't realize how much it was on my face until other people, when I started posting pictures.
Yeah.
And then they noticed it. And it's more like, I don't know, like how your makeup lays, or just how you, it's not like a,
Everything's brighter.
it is brighter.
I can tell you, like,
Smoother.
my
But
story.
it's not like I did it and I was like, today's the day.
Yeah.
I look amazing
No,
today.
I'm telling you, it was life-changing for me because I'm Irish, and so I'm very freckly. I have a lot of hyperpigmentation. I literally was the baby oil on the roof of the house on a tinfoil mat.
100%.
I grew up in that age. And so I had a ton.
Still doing that.
Ton of sun damage. And I can remember when I did it, I literally, like, all the men's came off and all the whatever. And I went to, it was a Sunday actually, and I went to church and I literally just put mascara on. I had moisturizer and mascara on, and I felt amazingly confident. And I would have to put so much foundation on to even out my skin tone so you didn't see all the dots everywhere. It was literally, it was life-changing. That's why I'm like, I will spend every dime on that. If I didn't work here, I would spend every penny on that every
Speaking of
year.
that question, things to look forward to. We're getting something called the Moxie.
I know, I'm pumped about
at
it.
Lewis Center. And from somebody who has absolutely awful melasma, so hyperpigmentation. I'm out at a soccer field, I'm out at flag football, like it's heat, right? So I wear my SPF, I'll wear a hat, I'll still have my melasma breakout.
Gotcha.
So this Moxie is amazing because just like you said, the halo, and you use the ablative word.
I know. I've
Adrian and I were really proud. I know, that's great.
I'm so happy I made you proud.
So this is fractionated non-ablative.
Oh,
Okay. And so it's safe for all skin types again.
Okay. So
And-
every race, every
Yep.
ethnicity,
Everybody.
Okay.
Everybody. And it's wonderful for stubborn things like melasma. And we trialed this again. We always go through, before we bring on something, we go through it. And so how many of it? 3 of us did it that day?
Did it. Yeah.
Yeah. And I was amazed.
So explain to me, how would you use that? So like so say I walk in and I love Halo and so how do you differentiate who would get a Halo, who would get a Moxie?
You need both.
Oh, really?
Yeah.
In like what order, or like, is it Moxie more maintenance and Halo's like the granddaddy, like let's blow your face off kind of thing?
It's a little bit more aggressive.
Yeah, it's based on concern. So if you came in and you said, hey, I've got this pigment, I deal with melasma, or, I've got, I just want my skin to look brighter, you're getting Moxie. But if you're coming in and you're saying like, I don't like my skin texture, I've got some old acne scarring, you're going to get a Halo.
Gotcha.
So the Halo is really meant to ablate or to destroy some tissue so that your body has to fix it.
Right.
And then the Moxie is working more from a heat-based standpoint, more so on a pigment base.
So who wouldn't be a candidate for laser? I mean, you're talking Halo and BBL.
Somebody who's dead.
Yeah. Melasma.
Well, BBL is restrictive, right?
BBL can be
It
certain
can
skin
be.
types and certain skin conditions.
Okay.
I use it like with melasma and like certain Fitzpatrick's or skin types. I say low and slow.
Gotcha.
So you can't be like gung-ho
Gotcha.
about that. So my melasma I've treated with BBL and had great response.
Okay.
But it also depends on like the level of your melasma. So they have like dermal melasma, superficial melasma.
Yeah.
And
I
along
love that you know that and can
I know.
diagnose. Like,
people,
I think
I'm
that
just
sets us
saying my
apart.
experience,
Yeah.
that people would not have known that.
There are some superficial or topical pharmaceuticals too that we can have you do to help make sure that we prevent any complication afterwards from a laser.
That's why skincare is so important.
Yeah.
And you're going to yield so much more. Like, I know people think that that's also like a cheap upsell, but I promise you, using this type of skincare before you have any sort of these interventions, you will reap more benefits from it.
I mean, you think you're spending, for, a laser, say, I'll just throw out $1,500, you're doing this every day. Like, you have to put good stuff on your skin every day of your life. Like, what's the point, right? I agree. And then, like, BBL also falls in line with, like, laser hair reduction, too, right?
Yeah. So we like our laser hair removal. The system is, the Cyton system that we use is great. I always call it the Cadillac of lasers because it can really,
It is.
Yeah, it is.
can do it all.
I agree, 1,000,000%.
And, we start our packages at a series of 6. We're pretty honest about the fact that you might need more than that, but all of it's looking for, I'm going to teach you a new word. All of it's looking for a certain chromophore.
Okay.
Okay.
Haven't heard that one.
Okay. So for reds, it's hemoglobin.
Okay.
Okay. For the brown pigment, it's melanin.
Gotcha.
Right. So the chromophore for hair is going to be the pigment in the hair follicle.
Okay.
Okay. So it's looking for a certain chromophore, and when we change the filter to hit the hair follicle, it's super effective. Obviously, darker hair is better.
Ask her about her experience with laser hair removal.
I need to do it again.
But how many have you done?
Yeah, I've only done it twice.
twice.
And it's amazing.
What a game changer, right?
It's a game changer.
That is the one thing in
mean-
this practice I've never done.
Okay, can I be honest?
No.
Can I be honest?
I'm
for
just not a
once?
very hairy person, so it hasn't been a priority.
No, go ahead.
Go ahead, please.
No, be
Come on,
honest,
for me,
girls.
that's
This is
okay.
honest.
No, I just feel like this is not just. This
It's
is not
okay. You can
you
throw me out of that,
specifically. It's so people are so predictable, right? And we're all the same.
Yeah.
So people come in, they're like, I want bikini, laser hair removal, just bikini. And you're like, Brazilian. Everybody knows the difference. Brazilian includes the backside.
You have to get up on all fours though.
It's all things.
So bikini, wait, I'm a novice, so let's just put it out there. So bikini is basically if you have a bikini on, you're doing the hair that would be outside of the bikini.
Yes.
A Brazilian is everything's gone.
It's
from
butthole.
front to back.
It's butthole.
Yeah, butthole gone.
Everything.
No hair.
Everything.
No hair.
Yeah.
No hair. She gone.
She gone.
Yeah.
So everybody's predictable. They come in, I'm here for bikini, laser hair
It was
removal.
literally like my second month.
And you may or may not have been like this. And then the first treatment, you come in and they have like a smear of numbing hair and a smear of numbing hair, and they leave their underwear on every time. Every time. Every first treatment, the person has their underwear on. Okay, and they're like, "Oh no, you don't need no." Just whatever's outside the underwear. And you're like, okay.
Yeah.
Are you like that with me?
Yes.
You rolled your eyes.
1,000,000%.
I'm always rolling my eyes.
She is.
Not at real patients. Not at real patients.
Behind
just
those
at
laser
me.
goggles, for sure.
Behind
Oh.
the people she knows, yes.
For sure.
Yeah.
Boom, boom, boom. Comes back. You go in for the second treatment. Underwear's off. Slathered in laser or in numbing cream. And they're like, take it off.
Yeah.
Every time. And then you're like, okay, either get on all fours
Okay.
I
or
did not
do your
on all
knees to your
fours.
face. But that is true.
Yeah,
Because
I was
it is
more
like,
liberal with my numbing cream.
I love it. This makes me think of when you did my Diva No Shot. So she was training somebody.
amazing.
And I'm literally up in stirrups and she's training somebody to do it. And they're both down there. We're friends. There's no
And you know, Carrie,
no
there's
mystery.
no better
Oh yeah, perfect.
dummy patient to do. Whatever
I
you
don't
need to
care. It doesn't hurt me. Just do whatever. So my legs are up. I have two of my coworkers / friends down in my vajayjay.
Hoo-ha.
Hoo-ha, whatever you would like to call it, the really medical term for it. And it was it's hilarious. And I have a picture of it, but that's the beauty of being there. We try
No,
everything.
the best
and
part is,
everything.
remember she was trying to put the shot, and I was like,
You just gotta go.
I'm not very patient.
Gotta get in there.
I'm not patient.
Yeah.
So I was like, okay. No. And then I do it. And she was like, oh, that felt different.
Yeah. I go, Angie, I'm you're training. I go, just try that again and I'll tell you when you do it like her.
Gosh, you're a really good patient.
Oh yeah. I was
I
was like, all right, do it again. Nope, more. Nope, more. Okay, you got
She
it.
was needling her at this time?
It's just the O-shot injections.
Yeah. And
amazing
Diva.
that
We
you
did
did
a
that.
Diva too. But that's
both
what
of
we
those are
do because
great
it's
for our
like
patients.
amazing.
great.
I'm telling you,
unbelievable.
they are life changing. We haven't even like
We haven't talked
dove
about it
into
yet.
Diva.
It's gonna
But
come.
I'm not kidding you. It
We're
is
gonna
like
talk about sex.
literally.
Let's talk about
It's
sex,
life-changing.
baby.
It's
Let's talk about
life-changing.
you and me.
Seriously.
We're gonna talk about vaginas and the
Ooh,
importance of
she said
healthy
the V.
vaginas.
Yes, and I'm telling
I mean,
you
my
this.
kids, I talk about vagina. It's not a bad
Yes.
word.
It's
You have
so
to have a healthy
important.
vagina.
It shouldn't be taboo.
No.
I always say this. Like I tell my kids this. They're adults now and they're married and whatever. And I'm always like, the only thing that makes your relationship different with your spouse than any other person, meaning you guys too. I could hug and give you a pet kiss and whatever. Like we have like a relationship. The only thing that makes it different with your spouse is sex. So it's like, if that's not going well, like it's gotta
It's
go well.
important. It's
because
important.
it's the only differentiator between you and any other relationship that you have. You can have intimacy at a friendship level with a ton of people in your life. For
sure.
But it's the only thing that like makes your relationship different. And so it's so important, and women are so afraid to talk about it. And it's like taboo. And it's really, let's be real, it's really like 25% of women have orgasms on a regular basis. It's not
only 25%.
only 25%. So it's very hard for women,
Yeah.
and it's something that we need to talk about. And women need
It
to
is.
enjoy it as much as men.
Not
like
as hard
I'm
for
sick
men.
of it. Like
Is that
let's
what you wanted
enjoy
to
it
say?
as much as men.
No, but I was just thinking, like, rewind to our Christmas party this year.
Oh God, what?
And it's so
Courtney.
adorable. It's Courtney, our sexual health
Oh
PA.
God, yes.
God bless her heart.
Yes.
She is as nice as she seems,
She
people.
is to the
kindest-
core. She's to the core.
I have tried to find
I
her
don't
on
even
Courtney.
want to
You
invite her to
can't.
my
No,
house
no.
because my kids are going to be like,
I mean,
So
the
she-
light shines behind her
I know.
when she walks.
She has
She's
a halo.
the sweetest person ever. Yeah.
So-
and the fact that she does is in
know.
charge of this part of
I
our
know.
business is so
I know,
love
but
it,
the best part is, you guys, so we walk into the Christmas party and like I always have to, Brent like just
Yeah.
doesn't remember it. And we've grown, right?
Yeah,
We've
yeah.
grown.
Yeah.
So I'm like, this is Courtney, like she does functional health, she's a PA, she does sexual health, and Brent, obviously men are like, ooh.
Yeah.
She said sex. And she was, I don't know, Brent like was just being polite and asked her a question, Courtney. And like my husband was like, I didn't mean to go there. But she was like, I love orgasms. Everybody should have orgasms.
Yeah, I'm the
Isn't
orgasm
it
doctor."
sad if you don't have an orgasm? And my husband was like, I'm with her. Yeah. Everybody likes orgasms. It was so funny.
So, all right. So I 1,000,000%, we always walk in your office and we always are like, I feeling like, what do I need? And you'll give your opinion. So Dr. Weston, what would you recommend if she sat in your chair, a virgin patient, what would you do for her?
okay, be gentle though.
You're even pulling back the hair.
Be gentle.
I love the
Well, you want my facial
collaborative-
structure. I don't have a clip, but
I like always to point out the like beautiful things about somebody too.
yeah. Let's do that.
Which
And then deliver the bad news.
yeah,
Good, bad, good.
ease in.
Hey,
So here's the
about
thing.
balance.
If I'm looking at her, the thing I love about her is that she smiles with her eyes. So when we're talking from a Botox standpoint,
beautiful.
I don't want to knock out your ability to smile with your eyes.
And you haven't ever. Because I have Botox right now and I can still smile with my eyes right now.
Correct.
Do I?
So
Amazing. Yeah.
Amazing.
we do a light little like sprinkle so that you are able to have a little wrinkle control without losing the movement that makes you like sparkle. Okay. If I were going to add anything, I think we would add a little neck Botox
Obviously.
to help soften some of the platysmal bands.
Girl, you need to do that.
Yeah,
Don't put
can
that
we
The
on.
do
other thing
I want to see the
I don't usually go,
The other
I know,
thing
but I wanna see the
that I would
results.
add,
I guess
since
when I
you
smile, though, it
do
does
like
kinda-
your Mentalis Botox, is
I have Mentalis Botox right now. And
I know. I think
Because
I
I
might
have a really,
also talk to you about a little DAO Botox.
Oh.
but I think we did it one time and my smile went like
About
this.
what Botox?
So what I would do then
My smile went like,
is
DAO?
and that can
Depressor?
absolutely happen.
Yeah.
So
So
what I
what
would
do
do
you
is
do?
I
Down
would
to
tighten up
the
your
corner of your
dilution
mouth.
so that we don't have a spread that affects your DLI.
I'm willing to try it again.
Oris Anguli.
I love
It made my smile weird the first time I did
Yeah.
it. But that's why I love that if you have an injector that you know, you can say,
I didn't
Instead
like that.
of saying, I'm never going to do that again,
Yeah.
I could say, I didn't, like, it did something weird with my smile. And then she just said, well, I would change the dilution. I'm like, okay, I'll try it again.
Well, it's a
'Cause I
slow
trust her.
feedback. It's a slow feedback. We inject you, and then we don't see you for most patients.
Yeah.
I mean,
Yeah.
I see you in the office, but
It was just in pictures.
Unfortunately,
in
we
pictures,
see you every day.
yeah, you know.
Did you say, fortunately?
Only 3 days a
That's
week,
it.
actually, but she comes in on her days off, so it's more
Yeah.
than that. Yeah.
But for most people, we inject you, we don't see you. So I need that feedback when you come back. When you're like, I didn't really love this. Great. It's a moving target of tweaking, so we get where we need to get.
It's a
It
process.
should not
That's
be
what is
cookie
nice
cutter
about-
every single time, because it should be based on your anatomy, your movement, your face at that time.
And your goals.
I have a question. This might go off topic.
That's okay.
Can you talk about filler around the nose?
Oh,
Around
Like for a
liquid rhinoplasty?
Like for a, is it a non-surgical rhinoplasty?
In
You
the
use filler
nose?
in it?
In the nose? On
I
the
don't
nose?
know
Like
where
on
you
the
can put
nose,
filler.
like this?
I just mean non-surgical
Non-surgical
so this is
rhinoplasty.
like, I did not know a lot of these things existed. I did not know that non-surgical rhinoplasty was a thing until I started working here. So can you just
Yeah,
like
I can tell you.
what is that? What noses would you want to have?
Yeah,
seen?
there's, well, for me, knowing that I have, again, Dr. Seifert in my back pocket, who's an amazing plastic surgeon who does amazing rhinoplasty results, who I've also trusted with my own face. The risks have to, or the benefits have to outweigh the risks, right? As with anything. It's one of the more riskier areas to inject. So I've kind of figured out what I'm comfortable with as an injector and what I think works for that area. For me, it's somebody not who wants tip refinement, not who wants narrowing of the nose, not who wants, their nasal ala rim to be more narrow. It's all about the dorsal hump. So from your profile, when you have a big bump, and it's right up top, it's right where it should be, then you can put filler here, you can put filler here. And we're talking like 0.25 cc's.
Not very much.
Okay.
It's very small amounts.
Okay.
That can help kind of camouflage that slope.
Okay.
And I pose it as kind of on the road. We talk about like using it as a diagnostic thing. If you like this on the road to your surgical journey, that's typically what I'll do.
Okay. I love it.
But I'm really picky. There are people that do different injections to try to help, lift the tip, or they'll do columella injections, and that's just not where I want to be.
Yeah.
And
You can Botox it.
you can.
What do you Botox?
Yeah, you can Botox actually the nasalis here, you can Botox here, and these nasal muscles, and they say it slims it. Injector Bunny posted something about it.
It does help to slim the nose, but it's more in movement, right? So the idea of toxin is to inhibit the movement. Okay. So if you smile and you pull or flare,
And you do like weird stuff with your
or
nose.
your tip curves, or
down.
you can.
That makes sense.
Which if you have
It's a thing.
it's a thing.
It's
looks
very
beautiful.
like noticeable.
Okay.
I've seen people that
it's a
have
thing.
that.
It's a
very
thing.
beautiful.
Yeah. And so normally I wouldn't recommend, like, I don't love doing a lot of Botox like down here, but for something like that, I would definitely do that. But yeah, I'm really picky about my non-surgical rhinoplasty patients. And so I would say
As you should be.
85% of them go to have a surgery consult.
Right.
And just to touch on that, because it is a super, dangerous procedure. Like you can have
All filler's dangerous.
It all
by the way.
it is very
all filler is
But
dangerous.
you are very experienced, and the fact that you are picky on what you'll do and not do because of that, it's that just goes to show you better know, your injector better know what the hell they're doing if they're gonna do that, because it's, I don't know, it's a very
There are risks involved.
Yeah.
And the nasal structure has a higher risk of a complication than other areas.
yeah.
Adrienne has to go be a mom.
Yeah, I know.
And go see your son.
I have to.
And
Go Braves! Hopefully,
family first.
Lacrosse,
Go Preston.
Always
Lacrosse.
family first.
Yep. Cheers.
Next
next time.
Next time you're gonna have us back, because this was the best one we've ever done.
I know.
And then I'll
It
get
was
this
wonderful.
done beforehand.
I'll do all this stuff.
I'll
so
do
we can talk about
Morpheus
it.
and
you guys will
things.
have to reintroduce yourselves because no one will recognize you.
Very true.
That's not true. We still make you look like you.
From the
That's
best
true.
standpoint.
They'll be like, oh my God, it must be her
They're
younger
gonna say,
sister.
"Did
I'm gonna
Marguerite
enter
bring
in
her
from behind
daughter?"
because I'm gonna have sculpture in my butt. You don't know who I am.
Okay, guys, I am energized just thinking about all the amazing skincare and aesthetic options out there. I hope you learned as much as I did today, and we've got plenty more answers to come. Join me next time on Asking for a Friend, where we'll talk about every gal's favorite topic, hormones, or maybe not so favorite topic. From what's going on inside to how to balance your hormones and boost your energy, and so much more. If you like what you heard today, don't forget to hit subscribe, share this episode with others, and of course, follow us on social media. Until next time.